Welcome back. We're still joined by journalist and broadcaster Jenny Kleeman, former Conservative Culture Minister Ed Vaizey, plus Dr Amir joins us from West Yorkshire this morning. Morning to you, Amir. Thank you for joining us. So just before the break, we were just sort of highlighting some research that was saying that a considerable number of parents are very nervous about taking their children to get the care that they need because of what's going on in the NHS at the moment, the pressure that they're under. Could you just explain a little bit about the research and sort of maybe allay parents' fears as to what your experience is?
Yeah, morning. So this is a survey carried out by parenting website Mumsnet. Just over 1,000 parents responded to this, and 40% of them were worried that they couldn't get access to medical care if their child became ill on the day. A third of them said they struggled to get GP appointments, and some of them had to take their children to A&E. They go on to complain about wait times in A&E and waiting for NHS 111 to answer the phone as well, which is really worrying for parents, because the one thing you want as a parent if your child is sick is to be able to see a healthcare professional so they can get right. Interestingly, rather than blame the healthcare professionals, 86% of those surveyed blame the government for these policies. What I would say to worried parents is, as a GP, we do prioritise sick children if they get through to us, and we will do our best to see them. Obviously, we can't see everyone because, Rishi Sunak is interested in maths, and the simple maths is there aren't enough GPs. There's 6,000 fewer GPs, which means there isn't enough appointments to see every sick child that needs to be seen. And that is something that needs to be remedied. But all of this is a symptom of the NHS in crisis and chickens coming home to roost. We've had so much austerity, not just in the NHS, but across all public health services, which has resulted in poverty, and poverty causes poor health. So austerity in child health services, child services, social care, school budgets, all of that is a cycle which results in poverty and poor health on the back of a financially struggling NHS and a workforce crisis and people who are burnt out within the NHS as well. So that is all why people can't get to see a healthcare professional in a timely manner. We are working as hard as we can. We want to see people as much as we can, but there's only a certain number of people that we can see as GPs safely through the day. The problem is there just isn't enough of us, but we'll do our best. If you get through to us, we will do our best to prioritise children and see them.
I had an A&E dilemma, Dr Amir, on Tuesday evening. My daughter Darcy did something stupid with her earring. The stupid thing was getting it pierced in the first place, frankly.
I'd imagine Mum wasn't best pleased about that.
Got a second piercing without telling me. But anyway, that's another debate. Anyway, she went to pull it off and the whole earring went inside her earlobe. Now, it was bleeding a lot, but I was thinking, what do I do? I know this is not life or death. I would have done, Dr Amir, but it was very late at night and I knew you were on Lorraine the next day. Otherwise, I would have done. But I thought this is not life or death, but it's probably not going to stop bleeding. Doesn't feel like a GP thing because it's going to have to be looked at. So we went to A&E. We were there until 4:45 in the morning from 11 o'clock at night. I knew that was fair enough because it wasn't life or death, but there was only one doctor in A&E for kids, and the waiting room was full of children coughing and wheezing, all of them saying to me, because we had a lot of time to chat, I would have gone to the GP, but I knew I couldn't get in. It's a real dilemma, isn't it? Because you don't want to be one of the parents filling up A&E with inappropriate things, but you're not quite sure what else to do.
It's really difficult, and I completely empathise with patients who can't get through to their GPs. We've got to remember that GPs and patients are all on the same side. We want to help you as much as you need our help, but there's only so many appointments we can give out and only so many patients that we can see safely. The BMA recommends that GPs should only be seeing around 25 patients a day safely, and I can't remember the last time I saw just 25 patients in a day. It's way above that. Some GPs are seeing 60 to 70 patients, or doing 60, 70 patients contacts a day. So we are working in unsafe environments, but if you are struggling to get through, there is 111 if A&E isn't the most appropriate place for your issue. I think with something like Darcy's ear, it'll be difficult for a GP to manage that because we don't have the equipment to pull out something like that. So A&E might have been the most appropriate place for her. But for coughs and colds and wheezy children, primary care is the best place for them. We just need to support it more. We've got to remember that primary care or that GP surgery see around 1.4 million patients each week. That's 10% of the population on a minuscule budget. So we are doing our best. We just need more people here.
Did they recover the earring, by the way?
They recovered the earring.
Right.
The doctor wasn't very helpful, though, Dr. Amir, because I said in a very loud voice, this would have happened, wouldn't it? Because you didn't tell your mum you were having a second piercing. And the doctor said, no, it's nothing to do with that. And I was like, who's signing you on?
I can't believe Bill wasn't there ready to take it out.
Yeah, exactly.
There's a story, Amir, on the
eventually.
front of the Times about the nurses' strike. And suggestions from Pat Cullen that actually the nurses' union would be willing to take a 10% pay increase. It's something they've had no response from the government on at the moment. Initially, they were saying that they wanted about 19% was inflation, in line with inflation. That feels like quite a moment for her to be able to turn around and go, look, we want to get this sorted. We would be happy to negotiate. The government insisting that they're not going to sit down and talk about this, though.
Yeah, I think this shows how much the Royal College of Nurses are willing to compromise and how much they don't want to strike. It took a lot for them to take strike action. And Pat Cullen has shown her cards now. She said, look, we understand 19%, even though that is in line with inflation, isn't really realistic, but 10% would be more realistic. Please come and join me at the negotiating table. But the government aren't playing ball. They are not meeting them halfway. And they're standing really behind that independent pay review at 4.3% increase. But we've got to remember that is now out of date. Inflation has skyrocketed since then. We've had a disastrous mini budget, which has cost the economy billions as well. But they're still hiding behind that pay review. We need them to come to the negotiating table and put an end to this misery, both for healthcare staff and for patients.
Psychologically, Ed, you worried that if they've given that hint, and Jenny as well, that hint that they might be prepared to consider it, it's almost a game of who blinks first and chicken, isn't it? And the government will think, OK.
Yeah, I was quite surprised that that Pat Cullen was so frank about it. I mean, it's probably, without wishing to trivialise the issue, it's a very, very serious issue, but negotiating 101, it'd be very surprising to effectively tell the person you're negotiating with what you're prepared to settle for. But clearly, on the other hand, it may be a sign of genuine desperation, wanting the government to engage. And I've said again on this programme before that, you know, I suspect the government's point of view is kind of the slippery slope argument. The minute you sit down with any union to negotiate face-to-face, instead of keeping, as it were, that arm's length principle between the pay award bodies and the unions, you know, where does it end in terms of people coming to your door demanding pay increases, demanding the government gets involved?
There's huge support from the general public in giving healthcare workers, nurses, a pay rise. The government know that. The government know that they're not particularly popular right now as well. As Amir was saying in that research about on Mumsnet, squarely the responsibility for the frustration parents are having of not being able to get their kids the treatment they need, they leave at the door of the government. It feels like, and as Ed was saying, you know, in negotiations, to be able to turn around and say, this is what I'd be willing to take, might seem a little bit sort of naive, as it were. But actually, would it not be sort of worth the government sort of looking at it and going, let's curry some favour, let's give the nurses something of what they want. We know the public want them to have it. We need to win some sort of good favour now, and this would be a good way of doing it.
I think a lot of people feel that the government has been really absent. We haven't heard enough from Rishi Sunak and Steve Barclay on all of this. And as you say, there is enormous sympathy for nurses striking. People know that nurses, emergency care workers could go and work abroad and make a lot more money if they wanted to. They have chosen to work here. And so I think this 20%, 19% they were asking for, I think they didn't really think that they were going to get it. We know that the new head of the TUC last week was effectively saying he didn't think that it would be possible for such a pay rise. They are looking reasonable now. It's time for the government to step up and say something.